This is a follow-up to my video on how to improve and work up to a pistol squat, specifically for people that experience pain at the front of their hip. If you find it difficult to extend one of your hips while sitting in a deep squat because of pain at the front of your hip, here are some reasons why that might be happening. Your rectus femoris muscle might be tight, thickened, and causing there to be less space at the proximal attachment. Because we sit most of the time with our hips flexed, keeping that muscle in a shortened position, and you rarely, if ever, extend the hip, lengthening that muscle and its tendon. That rectus femoris muscle also tends to be weak and inhibited in many cases. This also contributes to the problem. So how does lack of stretching in that specific muscle and it being weak contribute to problems and pain in the hip? It's because stretching and contracting the muscle both put force through that specific muscle's tendons. This stress applied to the muscle and its tendons encourages proper alignment of fibers and over time can help break down adhesions formed by the body. What do I mean by adhesions? Just like adhesive tape, the body constantly lays down resources to help maintain and repair tissues. The rate at which tissue stiffens up and impedes range of motion will depend on the individual. There are some people that maintain very good flexibility throughout their lives, barely having to practice it. For the most of us, that's not the case. We have to constantly lengthen tendons, contract their corresponding muscles in full range to maintain our mobility and limit the restrictive effects of this natural ongoing process of our bodies laying down randomly oriented patchwork. Another spot that can become stiff and thickened at the front of your hip is the anterior capsule of the hip ball and socket joint. The same thing as in the case of the tendons can happen to joint capsules in ranges that aren't used. The earlier you can catch this and address it by practicing full range of motion and stability through your joints, the more likely you'll be at reversing it. Why is this thickening and stiffening of the joint capsule and tendon painful? Aside from the pain receptors in the tendon and the joint capsule, surrounding structures, in this case, the femoral artery and the femoral nerve, can also get irritated by virtue of having less space to pass through. So how can you prevent or reverse this pain at the front of your hip? Do less of the things that cause it, like sitting, and do more of the things that can reverse it. I'm going to show you 5 exercises you can do on a daily basis to help reverse this pinch at your hip. The first exercise is upside down mountain climbers. Laying on your back, you're going to put some resistance against that rectus femoris by pushing against your knee while you pull it towards your body. Give it about 30% of force. You can start with 20 reps in total. The next exercise is kneeling hip flexor stretch. Make sure when you're doing this stretch that you're squeezing your glute tight and you're also bracing your abs. You should feel this stretch all the way from the front of your hip down into your knee. With any of the stretches I recommend, I like to add a dynamic component. This means that you're moving throughout the stretch. So you're going to contract into the stretch, pull your hips through forward, hold that for a few seconds, and then release, relax. Again, brace your abs, contract your glutes, bring your hips forward a little bit, get that nice deep stretch through the front of your quads and front of the hips, and then relax out of it. Get 8 reps per side. The next stretch is standing quad stretch. Similar rules apply with this one. Abs stay braced, and you're pulling your hips through. Squeeze the abs, squeeze the glute, pull the hips through forward. And you should feel this stretch through the front of your hip. I also add a dynamic element to this stretch. You're going to contract, pull through, and then relax. Contract, pull through, hold for a couple seconds, relax out of it. Repeat for 8 reps per side. The next exercise is elevated hip extension with PNF. This combines stretching and contracting. PNF is a powerful tool to help improve range of motion. Make sure to brace your abs. You'll hear me saying brace your abs a lot, and the reason is your abs are a major anchor for your hips to stay in a neutral position. Without the support and contraction of your abs, your hips will follow the path of least resistance. In this case, they'll be more prone to rotate forward, following the path of your tight rectus femoris muscle. Contracting your abs helps counteract that tilt forward. It brings the hips back to neutral, keeps them there, so that you can get a better stretch throughout that tight rectus femoris muscle. When you're setting up for this elevated hip extension with PNF, Put the leg that you want to stretch up onto the surface of the couch. Then you're going to push your knee down into the floor and hold it down for a few seconds. So it's as if you're bringing your leg, your knee to your chest. So you're pushing down into the couch, hold for a couple seconds, and then release. While you're releasing, you're still maintaining that brace in the abs because you want your abs to bring the hips to neutral and create a better stretch for the front of your hips. Push into the couch, hold for a couple of seconds, and release. Repeat. Push your knee into the couch, hold for a couple of seconds, contract, and then relax. Sink into the stretch. Once again, contract, pull your knee into your chest, down into the couch, and relax and lengthen. With consecutive repetitions of contract and relax, you should be gaining range of motion in hip extension. I use a similar technique in manual treatment for anterior hip capsule release. Although the manual treatment tends to be more effective because I can add traction and rotation to help release that anterior hip capsule. What I showed you here is the next best thing that you could do on your own with minimal equipment. Now that you've improved your range of motion in hip extension, it's time to work on controlling your available range with some glute bridges. Start with 8 reps. Perform these slow and controlled, and make sure you're contracting your abs so you don't overarch your back. Contract your abs and tuck your tailbone. Once you get good at hip bridges with 2 legs planted on the floor, you can work up to alternating feet. Hopefully you found that helpful. Feel free to leave me comments or questions below and check out my other videos on training, lifestyle, rehab, and nutrition.